I'd like to pay special attention to a category of people that are not represented here. I think children are not here, and many of us are parents, and we want to be able to make sure that we care for children with their anxieties as well. So you have to learn a few things as well that pertain to how children experience anxiety so that you can help your children. So I'm going to talk to you a little bit about anxiety in children and teens. Children and teenagers also go through anxiety, and a lot of my thought will come from what Dr. Mark Crawford has suggested regarding how to identify the anxiety in children and teens. There's what we call pediatric anxiety disorder, an anxiety that actually manifests in certain ways that are most common with children. It's the most common disorder when it comes to anxiety disorders for children. Pediatric anxiety disorder. 1 in 5 children will have had an anxiety disorder at some time in their life, their childhood. 1 in 5. Which means we should keep an eye for our children, because sometimes they're going through an anxiety disorder and we think it's something else. I'd like us to have like an overview. I'm not going to go into details as to these disorders, but know that it's more of an overview. So as I go, I want you to take notice of the things I'm talking about and maybe do your own research later. So outside of pediatric anxiety disorder, we also have other kinds of disorders that kids go through, but I will not explain all of those. But at least pay attention to that most common anxiety disorder that kids experience. Now, how anxiety disorders can be misunderstood is something that is beyond what you can imagine. In children especially, it's often misunderstood for all kinds of different things except anxiety itself. So please do not fall prey to misunderstanding anxiety disorders in children. How are kids sometimes misunderstood when they are going through anxiety? Sometimes the anxiety symptoms can be misunderstood to mean or to appear as though they are not just interested in doing things. They are uninterested in certain activities. They are unmotivated to play sports in school. They are uninterested in school in general anymore. They are just indifferent about school. When you see this indifference, or what seems to be an indifference or a lack of interest or the lack of motivation in children and teens, sometimes it's anxiety happening. Now, at other times, anxiety in children appears to be the lack of concentration or the inability to pay attention in school, at church, in the playground, at home. They're just not able to concentrate when you play board games at home, for example. You wonder what's going on with my child. I like what Ross Green has said about that. He says, our explanations guide our interventions. When it comes to how we explain our children's problems, especially when they lack motivation or they are uninterested or they are just indifferent, it will guide the way we'll react to our children and intervene to their problems. So when you have a child and you see these signs and symptoms, lack of interest, lack of motivation, indifferent, please be careful before you start reacting or overreacting or intervening. Make sure that you check with maybe a professional or someone who knows how to diagnose kids with mental issues. Now let's talk about generalized anxiety disorder, especially in children. How does it manifest itself? Excuse me. How does generalized anxiety disorder manifest itself in children? Often it's excessive worrying. They worry to the point where it drives you crazy. Of course, we've all heard this common joke that parents play, which is not a joke because it's truly a reality for those parents who have kids who travel in cars to different parts of their countries. Kids, before you even are able to cover half the journey, they're already asking you, are we there yet? Because they are bored in the cars already. My kids are that way. They used to be that way. They're still that way anyways. In their teenage years, they still ask me, are we there yet? When we've not gone anywhere. Because they are worried about being bored. They're worried about being unable to have fun in the car. Excessive worrying is one of the most common symptoms and signs we see in children who are experiencing generalized anxiety disorders. Outside of excessive worrying, kids also manifest physical symptoms when they're experiencing generalized anxiety disorders. What do I mean by physical symptoms? There are some physical symptoms that are most common to children. And I want you to pay attention to some of these physical symptoms. You will notice that children sometimes just have this thing of sweating in their palms or perspiring. When they do that, adults as well do that, especially if you already suspect that they have anxiety problems. That may be a sign. Racing heart, you put your hand on their chest, ask them to feel their heartbeat. It's beating fast when they've not been running or anything. That might be a physical symptom that's very common both in adults and children. But make sure to look out for that. Sometimes they're just shaking. You find the child you would say that, this child, I can't understand why are you so unable to hold a glass or a plate without breaking it? Why are you so clumsy? It might be because that child is anxious and their hands are shaking and trembling. They might be anxious about holding breakable, cutlery or plates in their hands, or they might be anxious about other things related to their day. Just make sure you notice the shaking and say something about it. For adults, especially, you have hot flashes. I don't know for sure. I need to read up on this. If kids ever have that, but hot flashes and chills when it comes to generalized anxiety disorder are some of the physical symptoms that people have. All right? Maybe dizziness as well, feeling of choking, or even just difficulty breathing. Physical symptoms such as chest pain, fear of losing control, fear of dying. These are all physical symptoms that people experience when they are going through generalized anxiety disorder. Social anxiety. What does that mean? In children, we see social anxiety manifesting through the fear of social situations. Now notice, it could still apply to some adults, but I want us to focus on children. They are afraid, for example, to meet their friends, or to meet new friends, or to walk with you to the park, something you're used to doing with them for many years. Suddenly they're now afraid to walk in the park, to walk their dog in the park. Though you know they like it, but they are worried about meeting new faces or meeting other people. That might be a symptom of social anxiety. Of course, social anxieties also have physical symptoms, like the ones we mentioned before. Many of the anxiety problems you have their physical symptoms as well. Please, my simple goal here is just to make sure that you don't leave the children out. You watch out for it, because even as a therapist, sometimes I overlook these things in my children. And sometimes I don't intervene the right way because I overlooked anxiety. Now, let's talk about some triggers to social anxiety. What can trigger social anxiety in your child? Just in case your child was doing well socially and suddenly they are now unable to interact, they withdraw, they don't want to meet friends, they don't want their friends to come over, they don't want to visit their friends in their homes. It may be things such as reading aloud in class that can trigger it, and then it starts continuing from there. Maybe they are slow in reading, they're struggling with their reading, and they're being asked to read under circumstances that could lead to embarrassment, and they just start dreading to read in class. And then it extends to dreading to read aloud to anybody. It extends even to other areas of their lives where they are just now beginning to feel a social anxiety, kind of an attack on them in different contexts going forward. Something else that can trigger social anxiety in kids, especially if they already have been diagnosed with it or they are already dealing with it without it being diagnosed, is music or athletic events and performances. You see, I have a son who runs track at school for his high school, and he also plays the alto saxophone. There are times when I see him obsessively practicing both his track, doing it at home. My dad used to run track. Actually, my dad ran 2 Olympic Games, and 68 and 72, Munich, Germany, and Mexico City. And so we like to tell my son that he's named after my dad, therefore he should do his best to be a very good runner. He runs really good. He's run all the way from the districts to the regionals, all the way to the nationals in New York last year. But sometimes he just practices obsessively as though he's under duress, under stress, under pressure to perform. Let me tell you, athletic performances or events, or just even music performances, can be a trigger for social anxiety for kids. They don't want to go because they don't feel prepared enough to attend the event. They fear that they will lose badly, or they will do so poorly that they will be embarrassed by their friends. Let me tell you, when you see your child in that situation, watch out for the pressure they are facing, especially if they're involved in activities such as athletics and music and performances in general. Another trigger is joining in a conversation. Some kids, the very moment that they're expected to join a conversation, it triggers their social anxiety. They shut down. And they worry that others would bully them for that. So it's like a vicious cycle that goes round and round. So when you have a situation where your child feels triggered by such things such as joining a conversation, I want you please to notice that and to pay attention enough to seek for the right kind of intervention for your child. Another one, a very important one, is speaking to adults. Some kids get triggered when they know that they're going to speak to an adult, a teacher, a coach, or a Sunday school teacher, or even a parent, or uncles and aunties. Sometimes they just are not able. They stutter more than what they would normally have done had they not been struggling with social anxiety. That could be a trigger for them, and that could be something that persists after that. Or it could just be revealing what was already there, going undiagnosed. Attending dances or school activities. Some kids, the way they are raised, they're just not willing to attend those dances because they are not raised like, some of them are raised in very conservative circles, and so they will just shy away from attending those dances or school activities in general. But also watch out for whether or not it's a personality trait they are exhibiting, or just, again, social anxiety manifesting in their lives. When they refuse to interact, to go for such activities or events with their friends, social events. Another thing that is a very common trigger for children in the area of social anxiety is test taking. When there is a test, they can get very scared. They get worried. And they would say, I know I read, I know I prepared myself, but I just cannot get myself to take this test. They procrastinate. They try to get the teacher to set their test where they can take it alone in a special room because they are so anxious about taking tests among other people, even though they are properly prepared for it. Last but not least, as far as the triggers of social anxiety in children is group meetings or projects. Some kids just cannot do it. It triggers this anxiety within them. They have to meet with others to share ideas and thoughts about a subject matter. They just freeze. They're not able to function. and because of that, they don't perform well in school. And you may think your kid is not doing well, they're not brilliant. No, they might be dealing with anxiety. You just need to understand what it is and how to help children navigate the rough waters of undiagnosed anxiety. Now, let's talk about separation anxiety disorder. That's also something that we see in children. This is generally when there's unrealistic, excessive fear of parent abandonment. They think, oh, my dad is in the military, he's going to get deployed anytime soon. Oh, my dad, like I'm out here in Egypt for mission work, my dad is going to travel like he travels all the time. And because they feel if they're attached to the parent in a healthy way, sometimes they don't want the parent to leave so often. So they are not happy when they fear the parent is about to leave them for weeks or May days. And so they don't do well in school, they don't do well in their normal daily activities because they are worried that their parent will leave. At other times, separation anxiety disorder would manifest when there is divorce in the home, when the parents are fighting so much and the kids are worried that, oh, very soon our parents will not be together anymore and I'll have to miss one parent or stay only with one at a time, and they develop separation anxiety even before it ever happens because there is quarreling going on among the couple. So, notice that it's normal for you to be concerned when there is the anticipation of you losing the presence of someone you value. But what we're saying here is that it is a disorder when it's unrealistically so. When a child would be unrealistically freezing, unable to perform or do their normal activities because they are worried that someone will leave them. So, when you see these unrealistic symptoms, you know they might be suffering from separation anxiety disorder. I'm not saying you should diagnose your child. I'm just saying beware that kids, 1 in 5 children, deal with separation anxiety, with anxiety in general. Now, another symptom that you might see with kids who are dealing with separation anxiety is avoiding situations where they are not with their parents. They avoid any situation where they are alone to answer questions or to interact. So they are so clingy with their parents in such a way that is unusual, abnormal. For example, I have a child who drives. He is able to go to his meetings with his friends with my car. I've not bought him a car yet. I'm still hesitant to do that. And he drives his siblings to church. Church is like 45 minutes to 1 hour away. He drives on the highway, he's able to do that. But I would be surprised if he starts refusing to go to the Walmart or the convenience stores around, which are just maybe 5-10 minutes away. I would see that that's not where he is as far as his baseline. He is dropping. Why is he wanting me to drive him everywhere? I begin to say, okay, maybe there is something about separation anxiety. Why does he always want me to be in the car with him? Now, there might be other things happening in his mind. We don't know for sure. But I'm just saying that when a child who used to be able to do things by themselves are now refusing to do it without their parent being by their side all the time, that might be a symptom of separation anxiety, which is called avoidance of situations where there are no parents present. So, with separation anxiety in children especially, we see unrealistic, excessive fear of parent abandonment of them, and we also see avoiding situations where they are not with their parents. They would not go. And of course, there are physical symptoms as well. Let's talk about another kind of anxiety disorder we see in children called panic disorder. This is when kids have panic attacks. What's panic attack? An acute sudden fear reaction. Very acute, it's short-lived, but it's very strong. They might shout, they might scream because they are afraid of something. Panic attacks, and it happens often. With kids, you might see that they are terrified by something they see on the screen, that's not a panic attack necessarily. Maybe just be a horror movie they're watching. But when you see that often, sometimes for unreasonable reasons, you know that there may be a panic disorder going on here. And of course, they do have physical symptoms, especially with panic disorders. Physical symptoms, like I said before, would be racing heart, sweating, perspiration, shaking, trembling, chills, feelings of choking, difficulty breathing, dizziness, chest pain, fear of losing control of themselves, fear of dying. Kids with panic disorders experience those physical symptoms. Let me tell you, there is something about temper tantrums. Temper tantrums that kids throw that we sometimes misunderstand. We misunderstand that they can be undergirded by avoidance of a triggering situation. So, in trying to avoid a situation that triggers their panic disorder, we see them throwing a tantrum. And we say it's a temper tantrum, but underneath is a panic disorder that is only manifesting itself through temper tantrums. Please watch out for that in kids. And I want you to also look at this real quickly. We're almost ending here. Obsessive compulsive disorder in children. OCD. Many of you are familiar with OCD, how it happens, which are simply obsessions or persistent ideas or thoughts or thought images entering the mind of a child. Persistent ideas or thought images that enters the mind of a child, and some children cannot even explain it to you. They're just struggling by themselves. And I want for you to observe for these symptoms, to be able to tell you if maybe your child is dealing with persistent ideas or thought images entering their mind. Number one, contamination. They're worried of being contaminated, so they wash their hands a lot. Especially in these days of COVID. They worry that they are being contaminated or they're getting infected or some kind of disease or virus has transferred to them. Second, symmetry or exactness. You see kids that want everything, like when they're making up their beds, it must be straight. If it's not straight, they go downstairs about to leave, to go to the bus, to leave for school, and they run back upstairs to straighten it up because they want symmetry. Their mind says it must be symmetrically lined up before they can go. Exactness may be a sign or symptom that your child is dealing with obsessive compulsive disorder. Aggressive obsessions. Sometimes they would fight to make sure they get some things that they really, really think they crave for or they want. Watch out. That might be a sign. Sexual obsessions. Even children get obsessed with sexual things, sexual images. They want to see certain kinds of images. Even when you discipline them, you correct them, they go back to those places they try to see because there's some kind of a sexual obsession that's taken over of them. That might be OCD happening in their lives and we just don't know it. Religious obsessions, and these really goes to parents who are Christians. Sometimes you've been raising your child in the fear of the Lord to read the Bible, and if they miss one day, that's okay. But there's some kids, they would be so sorry, they would even cry because they missed one day. They would wake up at 2 a.m. in the morning to read because they realize, oh, it's my religious duty to read. If I did not read yesterday's chapter, then something will go wrong. Religious obsessions. They must go to church every Sunday, which is good. It's a good practice. But if you're out of town and they start crying about church, some parents will be glad about that and say, oh, my child loves God a lot. Maybe it's the religion that they like and they're obsessed with it. Watch out for religious obsession in children. The list goes on and on. I won't keep going. Just doubting obsessions. They always doubt themselves. They doubt that they've done something, or they're just overly checking to to see if what they thought was accurate. Compulsions are things people do to relieve their obsessions. So, note that compulsions most seen in kids are the following. Number one, cleaning the environment. They find themselves cleaning too much. That is a compulsion that we often see more in kids than in adults. When something is already clean, they still clean over and over. Checking compulsion. So a child can get obsessed with checking to see if they feel a compulsion. That is a kind of a vicious cycle they go in, and that's a bad place to be for a child. Watch out for that. If you see that, please seek professional help for your child. That might be a real thing happening for the child. Ordering and arranging their compulsion. Sometimes they order it in hierarchical form, like, oh, this one is the most important compulsion. I must do this before I must do this, and so forth. Watch out for ordering and arranging of compulsions, because that may be a real sign that a child is feeling this obsessive compulsion to do certain things that are not healthy for the child. Of course, there are other things such as frequent hand washing that both adults and kids do. Hoarding or collecting compulsively. That is what some kids do. And of course, blinking and staring compulsions. When you have these compulsions in a child, please don't take it lightly. It may lead to other things if it goes untreated for a long time. Rubbing and touching and tapping compulsions are also some of the compulsions children face. So, as we end this presentation, I just wanted at least to say some things about children's anxieties, so that when you notice it in your child, you know what to do. I pray that God blesses all of us who have children and gives us wisdom to know exactly when our children are dealing with anxieties and be able to help them as soon as possible. God bless.